Welcome to Future Back Drinking, a new podcast series from PepsiCo and Time. I'm your host, Dr. Athina Kanioura. As PepsiCo's Chief Strategy and Transformation Officer, I believe it's incredibly important to have conversations with today's industry pioneers about technologies, innovations, and ideas that are certain to impact all of us. In this episode, I sat down for a virtual coffee with Dr. Sree Chaguturu. Dr. Sree is Executive Vice President, Chief Medical Officer of CVS Health, and President of Healthcare Delivery at CVS Health, where he leads enterprise-wide medical affairs. Currently, he is focused on advancing the highest possible clinical quality standards, increasing access to care, improving patient outcomes, and reducing overall healthcare costs across the CVS Health enterprise. He has completed his residency at Massachusetts General Hospital, where he still continues to practice internal medicine to this day. He also serves as a lecturer at Harvard Medical School. With a very strong background in medicine and healthcare management, he combines clinical expertise with strategic leadership to drive innovation in the industry. Dr. Sree, thank you so much for joining me today on Future Back Drinking. We like to kick things off with a quick cheers. So here's to a great conversation.
Cheers. Thank you, Athina. I'm really looking forward to the conversation.
Same here. And honestly, as I was looking at your background and everything you have done, you have such an important responsibility for the society and for the organization. And I also want to congratulate you on your new role of becoming President of Healthcare Delivery of CVS.
Thank you so much.
So it would be great maybe to start with that. If you could tell us now as you step into this new position, what do you see as the biggest evolutions you'd like to see in the future of healthcare delivery? And what you would like to implement and ensure CVS remains at the forefront of this transformation?
Well, Athina, wonderful question. It's a really big question. So let me take a crack at trying to answer it. So maybe if I start with, what is going on in the American healthcare system today and what are the challenges and opportunities that we have? And then I can pivot to my own personal perspectives and how CVS Health can participate. But it starts out with, what do we want from a high-performing healthcare system? Whether it's America or anywhere in the country, we want something that's affordable, so control costs. We want something that's accessible. We want something that's high quality. We want great experience. We want our providers to have well-being. We want our system to have equity throughout the way that it performs. So cost, quality, access, equity, well-being, experience, all of these pieces. But when we look at the American healthcare system, we have challenges on every single one of those dimensions. We're spending about $5 trillion now. Close to $1 in every $5 our economy spends is on healthcare.
Wow.
So one would hope that we would have great outcomes in the dollars that we spend. But what we see is that we have higher mortality than other developed countries. Our life expectancy is about 5 years shorter than others in the OECD, the other developed countries. And then when we ask people around access and experience, if we just go to a cocktail party, go to a dinner party, you ask people around, are you happy with the access that you have, primary care? People will say, well, I would like a better experience. I wish it was easier to access. So I could go on and on about all of the challenges that we have in the American healthcare system. But that being said, there's just incredible opportunity and innovation that's happening in the American healthcare system to address these problems. And that's why, just me personally as a clinician executive, you talked a little bit about my background, but just very simply, I'm a doctor and I am also an executive. And the idea is that I want to be able to bring these two worlds together. How do we think about healthcare and then the levers of organization and business process improvement to actually have impact at scale? And why did I come to CVS Health? Is that this is healthcare at scale. So when you think about CVS Health, you think about the pharmacy. And so we have nearly 10,000 locations. We have about 5 million people walking in to a CVS Health every single day. 85% of Americans are within 5 to 10 miles of a CVS Health. So a lot of community access. And if you think about the pharmacy, it's the one place where you can go in and see a healthcare professional, a trusted pharmacist, without an appointment and to have care delivered and services. So CVS Pharmacy is a critical component, but we have other components to CVS Health. We have Athina, which provides healthcare benefits to 25 plus million individuals across commercial, Medicare, Medicaid, the exchanges. These are just simply different types of ways that you can get insurance. And Athina is participating in all of those. And then we have something called the Pharmacy Benefit Manager, CVS Caremark. So 1 in 3 Americans get their drug coverage from CVS Caremark.
Wow.
And we are one of the largest purchasers of pharmaceuticals in the world. And our purpose is to bring down the pricing of pharmaceuticals, and maybe we'll have some time to chat about that later. And lastly is healthcare delivery. And as you mentioned, this is the new role that I've taken on, including my chief medical officer responsibilities. And in healthcare delivery, we are focused on the parts that can help address cost, quality, access, experience, equity, well-being, focusing on primary care with Oak Street Health, Minute Clinic, which is community-based convenience care, Signify, which provides nearly 3 million home visits, and then a number of other businesses that help the healthcare system to essentially achieve those aims that I talked about. So I'm incredibly excited, but we have a lot of hard work ahead of us to improve the healthcare system.
You're spot on, and honestly, that's probably an industry that is ripe for, I would say, disruption, but massive innovation as well. You mentioned 2 of your acquisitions, Signify and Oak Street Health, and CVS has been investing heavily in acquisitions, I think more than $20 billion. And if you were to look at the critical domains where innovation, technology, home healthcare intersect, is this one part of the core strategy of CVS Health moving forward? You know, more at home, much more integration with technology. So help us understand a bit kind of what is CVS direction when it comes to digital health transformation, and how does the M&A strategy fit into that mix?
Sure, happy to do so. And maybe, again, I'll start with just like macro context here. If we think about different sectors of the American economy, the 2 most labor-intensive sectors are education and healthcare. It is very hard to create quote-unquote labor efficiencies in teaching our children in 7th grade, you know, the basic core education that we need to have. Same thing, to deliver healthcare, primary care, or to do a surgery, it takes a certain number of people. But what we see is that technology can help us, and I'm just talking about healthcare delivery, and healthcare is larger than just the delivery piece, but in healthcare delivery, technology has a real opportunity to help us with the people that we have do a better job. And what we see is a lot of variability in healthcare outcomes, but with technology, we can empower our clinicians to be able to manage populations better. So an example of this is that, you know, within Oak Street Health, we are providing primary care for some of the most disenfranchised in society. These are the elderly and those of lower income that have significant healthcare burden. And we use technology to help understand who is this population, who needs to be seen much more often. And we call them VIPs, Athina. When we find VIPs, we will bring, and we're using data and analytics and algorithms to identify those people that we need to bring in every other week or every week to make sure that they stay on their healthcare plan. That's a very different type of primary care than the typical primary care that we generally go in once or twice a year, if that, right? But it's using technology and data to better understand our population and to make sure that they actually achieve what they need to. Then how do you make sure that the clinicians have the tools when they are seeing that patient to quickly identify the needs of that patient, and how do I quickly address that? You have diabetes out of control. Let's make sure it's as easy as possible to address these issues of diabetes. So we have built something called Canopy, and Canopy is a technology platform that our physicians use and our care teams use in Oak Street to quickly identify the needs of a patient and to make sure that we can improve their health outcomes. I could spend a lot of time about the specifics of the technology, but for the audience, I would just say that we wanted to make sure that the acquisitions that we had great clinical care, but that technology was a key part of how that care was delivered, because we know moving forward, it's going to be the combination of people and tech that's going to help address those major problems I talked about at the beginning of our conversation.
Wonderful. And I think your acquisitions and the way you described it fits very nicely within the strategy of CVS Health, which is healthcare for everyone, right? And using technology to drive, of course, better health outcomes for the population. So as you are looking at the evolution of technology and how your industry has embraced us, AI is playing more and more critical role. I mean, there's a lot of discussion out there how AI can revolutionize healthcare, life sciences, drug discovery, solve for the biggest problems of society. And you sit at the heart of this industry transformation. So if you were to think of those critical AI applications that you are working on as CVS and with your team to embed within the suite of offerings that you have, can you maybe discuss some specific ones that you're mostly excited about?
Sure. So artificial intelligence, as we all know, and I'm saying probably the most obvious statement of this whole conversation, is going to transform every industry profoundly. In healthcare, the way that we've been thinking about it is that artificial intelligence will impact in sort of 3-4 domains. There's how does AI help improve the administrative functioning of healthcare? So like automating manual and repetitive tasks, registration forms or scheduling. So very administrative pieces. Then there's financial. How can we improve the financial and accounting practices and use AI to better identify ways to improve financials? There's operational. So how do you create better operating models? And then there's clinical AI. And I put clinical AI at the end because it's the one that's most exciting, but also the one that we need to be very thoughtful in how we approach clinical artificial intelligence, which would ultimately enable us to do better diagnostics and better treatment of patients. So let's take an example of how we are using artificial intelligence. So one, we want to quickly make decisions and help patients and providers get the care that they need. And many times that there's interactions between the health insurance company and the provider system on making sure that we make the right decisions around appropriateness of care. We are using artificial intelligence to quickly determine how we can approve cases as quickly as possible, make sure that the right clinician is able to look at that. And that has allowed us to reduce the time it makes for the insurance company to make decisions and make sure that providers are able to get the care that they need. We would never use artificial intelligence in denial of care, and that is completely out of bounds. But can we use it to speed up and make decisions, reduce the friction, improve the experience? For sure. Another example, and this is one that I use personally, and this is in the clinical AI space, is Athina, like I continue, as you mentioned, to see patients. And so historically, I'm sure many of you on this podcast have been in the situation where your doctor has got their back to you and is just typing away on the computer. And so now there's something called ambient AI. We have invested in a company called Abridge. And so basically what I do is I take my cell phone, I turn that on after I get the consent of the patient, and it just listens to the conversation. So if I am interviewing you and want to understand why you're coming into the clinical office, I can just have that conversation. It is getting captured all into the clinical AI ambient documentation system, Abridge. And then at the end of the conversation, it produces a full note. And that note can then be used to send to the patient, but also to put into the electronic medical record, which then can be communicated to all the other providers. That used to be another 15 minutes of work that I would do once the patient left my office and I was typing away. But now I have that note. I am not exaggerating here, within 30 seconds, at most a minute after that patient walks out of the room. So we have better fidelity in how we're capturing the conversations that are happening. I can actually spend more time being patient-centric. And we are reducing the burden of clinicians and reducing that non-patient facing activities. And it makes it a much more joyous way to practice. And I could give you very specific stories of how, I had a patient who would bring up what I thought was going to be a medical issue and a very deep personal mental health issue. And I'm not turning around looking at a computer. I am there present with that patient to talk to them. So that's what's really exciting. AI is really going to transform how we practice medicine. Moving forward, it's going to be there almost like a doc in a pocket, helping us to actually make better decisions in the actual next step of healthcare. And then we'll interact with you as a patient to make sure that you stay on that health plan. And if you aren't, then make sure that we get reconnected and reset your plan. So where we're going to be in 5 years in artificial intelligence is incredibly exciting. And I hope that brings to light, just a couple of examples of how we're using it at CVS Health.
Perfect. And as you said, what you just described is to focus much more on human-centered care. There is obviously those amongst on what AI can do also to the profession of being a doctor. If you were to put a bit now your medical doctor hat on, Dr. Sree, do you see a future where many of, I would say, the professionals in your industry are going to be replaced by AI agents? Or you see actually an enhancement of the specialization of the professionals with those agents? I mean, that's the typical debate in many industries. I think in healthcare, it's an even bigger debate than industries like ours in manufacturing.
So AI should never replace the role of patient and doctor human relationships in delivering healthcare. What we also know is that we don't have enough clinicians to be able to provide the healthcare that we need in this country. So we have a clinician shortage. And we also know that there's variability in the way that healthcare is experienced and the outcomes. So when I think about how artificial intelligence will play out, I think it's going to allow us to be able to see more patients.
So to be more effective, this is what you're saying.
That's exactly right. That's the next piece, is to be more effective in managing more patients. So I don't see this as replacing people. I think it's about really augmenting us. The other is we can really use this to create much more personalized healthcare experiences. And if it's okay, I want to just share like an example of how we're doing this at CVS Health. Let's take something like vaccines. With vaccines, if you're intending to get a vaccine, Athena, your rationale and reasons might be very different than mine. Yours might be that I really want to get a vaccine, but I just need it to be convenient because I'm very busy. I'm busy during the workday, and I need to know what are the times that can get to a CVS pharmacy to get my vaccine. I need to be as easy to book my appointment. I, on the other hand, am very cost conscious, and I want to know that there is no cost to me and that when I book that I'm not going to be hit with surprise charges. As CVS Health, when we reach out to people understanding what are the drivers and motivations, we can actually start to tailor the messages. So for a convenience-focused person, we know that we need to send that information by text message at this time when, Athena, you might be looking at your phone, and this is the convenient CVS pharmacy location for you. That's a personalized experience, right? As opposed to me, which is, Dr. Sree, you want this to be $0 cost. Your health insurance covers it. And by the way, here's the convenient location for you. But using AI and advanced analytics and can start to create these much more personalized experiences, and then to be able to help make sure that it's not only knowing who has a gap in their healthcare, but how do we help those individuals who have a gap meet their preferences and then use technology to actually close that last mile gap. So I'm really excited about how we're using technology to create more personalized experiences, force amplify, and allow our clinicians to do more and to do it even better.
Amazing. And I'm a big fan of your platform, by the way. And I get the personalized experiences. You know exactly where my CVS is, and I go there to do all my vaccines and my flu shots. So there you go. I'm the, living example of that.
Fantastic.
Of course, though, I'm very fluent in technology. my generation grew up with technology. My children's generation is like they are native. But what about the older generations? And how CVS is helping them to ensure that seniors can easily engage with these new platforms in a way that is intuitive and not too complex?
So one of the focus for our organization is to build out a seamless healthcare digital experience through the CVS Health app. And, if we think about, there's this concept of super apps, like how do you actually bring together multiple experiences? And we see in other countries super apps. What we see the opportunity is in healthcare is to create a healthcare super app. And if you think about CVS Health, we have pharmacy, we have insurance, we have healthcare delivery, many of these pieces that people are seeking for in their healthcare journey. And so in that digital app, and you can download the CVS app now, what you're seeing is an evolution towards bringing these experiences together so that you can manage your own personal health journey, whether it's, the health insurance, the pharmacy benefit, the retail pharmacy, over the counter, get convenient access to healthcare experiences through Minute Clinic, get healthcare information through our knowledge and education that we have on the platform. But the other thing, you asked the question around the elderly. When you look at over 65, the greatest part of that demographic is actually people aging into the age 65. They grew up with technology for the last 20 years and are incredibly savvy. And so we see growing use of digital technologies among the elderly. The other thing that we know is that healthcare is not a singular journey. It is generally done as a family or with others. And so when we build our digital experiences, it's about making sure that it's not just you, but it's your caregivers, your family members. The other thing that we're doing is that we're seeing that, the technology-human interface will continue to become easier and easier. And we spend a lot of time with human-centered design in our digital applications to make sure that it is designed not only for the elderly, but those who are blind or they have hearing impairment. But, human-centered design is incredibly important to how we build out our digital applications.
No, that's great and very intuitive as you think of and as you rightly pointed out, the concept of the super app. So it can easily integrate with all the aspects and the facets of healthcare and everything that you have to offer as a CVS ecosystem. Okay, now it's time for our lightning round. At the end of each episode, we ask a few quick-hitting questions to give our listeners the chance to get to know our guests on a more personal level. Okay, are you ready to begin?
Okay, let's go.
Okay, first one. So, what's one unconventional piece of health advice you swear by, but most people aren't yet talking about?
Well, I would say that there are too many fads out there in healthcare, and there's, all sorts of unconventional advice. And I'm going to give you the non-answer, but is actually the right answer, which is like, don't follow the unconventional advice. The conventional advice is actually really good. It's nutrition, it's exercise, it's mobility. And focusing on that in your 30s and 40s and 50s is really important. Getting your cancer screening is really important as you move into your 40s and 50s. And managing your cardiovascular and cancer risks as you move into your 40s and 50s is really important because those are the leading causes of death. So I wish I could tell you, take this supplement or do this fancy thing, but
well, you are
move.
A practicing doctor. I didn't expect anything else from you. So, okay, Next one. If you could fast forward 10 years and see one major medical breakthrough, what would you want it to be?
So we talked about artificial intelligence, but, if you back up, what causes death in this country and why do people pass? And it's because of heart disease, cancer, and for the young, it's mental health. And so for me, it's really just, can we continue to make progress in reducing cardiovascular risk in this country? Can we reduce cancer risk? And if you do have cancer, can we get better chemotherapies and treatments for cancer? And for mental health, we have a crisis of mental health in this country where we have a lack of access. And we need to have better ways to identify those patients who are at most risk of harming themselves and help support them and reduce suicide in this country. So To me, it's not one major medical breakthrough, but there are three major killers in our country, and we need to just continue to make progress on that. I talked about the fact that we're 5 years lower life expectancy than other developed countries. It's because of this. We need to continue to make breakthroughs in those areas.
Yeah. So in the fast evolving world of health tech, what's one piece of technology you've come to rely on daily, whether it's on your professional or personal, of course?
So I think I shared with you is that a bridge technology, the ambient AI, and it really has just transformed the way that I practice and makes me feel more human-centered when I'm seeing patients.
Perfect. Now, you are, of course, as I said, besides your executive role, you are a professional, a practicing doctor. So what's one piece of advice you'd share with a young professional to help set them up for a successful future in healthcare?
Great question. What we want, many of us who are probably listening to this podcast are in knowledge work. And as knowledge workers, we want mastery. We want to know we have mastery of the work that we do and that people recognize our mastery. We want autonomy. We want some creative freedom in what we do. And we want purpose. We want to know that what we do is having an impact on the world. So mastery, autonomy, and purpose. And so as you think about the jobs that you take, you want to have those three things. But it's not like you can go into a job interview and say, are you going to provide me mastery, autonomy, and purpose, right? It's kind of an odd question to ask. So underlying that is what actually creates the environment for mastery, autonomy, and purpose. And I think it's two things. It's who's your boss and what's the organization you're working in. The thing that it isn't is the actual content of the work that you're doing. And so what I have found throughout my career is I look for great people in great organizations because the questions that you're going to be working on will change rapidly. I joined in 2019 at CVS Health, and a few months after joining, was asked to detail out for our board of directors about this virus that was in China, and that became the COVID response. I wasn't hired to do pandemic response, right? But it was an opportunity to work with great people, a great organization to help support the country through the pandemic. So as you're choosing jobs, I think it's really important to focus on the people and the organization and worry less about the actual work, because I can guarantee you the job description that you started with is going to be totally different within a year of after you started.
Amazing advice. Now, it wouldn't be a Future Back Drinking podcast without this specific question. Who would you grab a drink with and why? Living or dead? You can pick whomever you want.
My wife.
Oh.
I mean, there's all sorts of famous people that you could talk to, living and dead, and I think that would be great. But, in the end, it's just being centered as a family and with those who you love and being around. So I don't mean to be overly melodramatic or romantic here, but...
No, I'm a romantic. I love your answer. And as a female, it's kudos to you. And I'm sure you will make your wife very happy with this answer.
Oh, yes.
Well, I know we don't have more time. I have a ton of questions. You, as part of the executive team of CVS Health, you are revolutionizing the industry through your acquisitions, through your practices, through the platforms that you are developing and delivering for all of us as customers of CVS and, of course, as patients in this country. So thank you so much for your time again. Goodbye and cheers.
Pleasure. Cheers.
Thank you for joining us on Future Back Drinking. I hope you enjoyed the conversation as much as we did. Be sure to like, subscribe, and stay connected on all your favorite podcast platforms. Thanks again for listening, and we hope to see you next time.